Critical Care Assessment, a new, powerful, revolutionary technology. Critical Care Assessment is a non-invasive, fully automated and portable computer-based system that provides a quantitative assessment including heart rate variability, autonomic balance analysis, arterial health assessment, stress assessment, cardiovascular fitness test, and ECG analysis. Benefits all medical branches, including primary care, cardiology, pulmonology, endocrinology, neurology, and pain management. The non-invasive, innovative technology behind critical care assessment involves computer analysis of heart rate variability with a 3-lead EKG and simultaneously measuring pulse wave velocity with a finger probe to get a comprehensive cardiovascular assessment of a patient, making it useful in most clinical disciplines of medicine. The autonomic balance analysis is obtained using an ECG signal to determine RR intervals during the entire measurement. The autonomic balance analysis measures sympathetic and parasympathetic activity and the balance of the autonomic nervous system from the HRV frequency domain analysis. The autonomic balance analysis is based on using an advanced HRV frequency domain analysis adjusted by diaphragm movement signal response. Sympathetic activity in the nervous system acts like a car's gas pedal, while the parasympathetic activity acts like the brake. If the sympathetic and parasympathetic activity is out of balance, you can be at risk for heart attack or stroke. An unbalance can also affect everything from breathing disorders to digestive issues. A cardiovascular fitness test is a cumulative fitness assessment that measures training or fitness level, cardiac and vascular coefficients, and the response of the heart vascular reaction during orthostatic stress, such as moving from a seated to standing position. These tests and assessments affect heart rate variability, monitoring the body's response to stimuli, such as medications and treatments. According to the American Diabetes Association, a patient's history and physical examination are ineffective for early detection of CAN. Therefore, non-invasive tests that have demonstrated efficacy are required. Pulse wave velocity assesses stiffness index, reflex index, and augmentation index. In addition, pulse wave velocity assesses the reflection of arterial elasticity and blood flow in the venous system, the contractility, tension and stiffness in the small arteries, and provides an indicator for left ventricle ejection power and elasticity of large arteries. There is a significant relation between left ventricular diastolic function and exercise tolerance in patients with left ventricular dysfunction, and exercise intolerance in patients with heart failure, and preserved left ventricular systolic function. Pulse wave velocity is measured by the finger probe. As the heart contracts, it creates a direct wave which travels down the arm, represented by the red curve. The direct wave is reflected in the lower body and travels backward toward the arm, represented by the blue curve. The direct wave and the reflected wave combine to form the dichrotic notch, represented by the yellow curve. Pulse wave velocity is an indicator of cardiovascular health, disease progression, and treatment status. Our pulse wave velocity analysis provides an assessment of the arterial elasticity of the large and small arteries. Using a 2-circuit bidirectional finger probe, the blood's pulse wave is followed from the time it leaves the heart and travels through the blood vessels down to the finger. The Critical Care Assessment System takes a snapshot into the cardiovascular system and evaluates arterial elasticity or arterial stiffness, which is related to atherosclerosis. Arterial stiffness is a major cardiovascular risk factor.